Cardiovascular disease, heart disease, is still a leading cause of death around the world. And the challenge is that much of it can be prevented, but we have to be able to know how to detect it early on. And we do some good tests, but it's different labs. Sometimes you have to go on a treadmill. It can be challenging to reach a large range of people. But what if I told you your eyes could tell us about our hearts? My guest today says the eyes are the window not to the soul, but to the heart. Joining me is Professor Alicja Rudnicka. She is Professor of Statistical Epidemiology at St. George's University of London. Professor, thanks for joining me.
You're very welcome.
So did we get it all wrong? The eyes aren't the window to the soul, they're the window to the heart. How does this work? Tell us what you've been studying.
Well, for a long time, actually, we've had an interest in the small blood vessels at the back of the eye. So the back of the eye is called the retina, and on the surface of the retina are lots of blood vessels, and they're quite tiny, and they're not as big as the ones that you'd have in your heart. But generally, there are a lot of diseases that can affect the smaller blood vessels, because at the end of the day, we have those capillary beds over our entire body, supplying all our organs to make them function well. And so the blood vessels, we think, tell us an awful lot about the vascular health of the body. And so we've been particularly interested in their form and structure. And we've been using artificial intelligence systems to extract information about the blood vessels at the back of the eye.